Welcome to Medical Licentiate Emerson Educational Channel. Epistaxis, the medical term for a nosebleed, may seem like a minor ailment. However, for medical students and practitioners, understanding its nuances is crucial. This seemingly simple condition can present with varying degrees of severity. It can be a minor annoyance or a sign of a more serious underlying medical issue. This video provides a comprehensive overview of epistaxis. We will delve into its classification, causes, diagnosis, and treatment options. Epistaxis is defined as bleeding from the nasal cavity. It's a common occurrence affecting people of all ages. However, children and older adults are more susceptible. Understanding the anatomical division of the nasal cavity is key to classifying epistaxis. Epistaxis is broadly categorized into two types, anterior and posterior. This distinction is crucial as it dictates the approach to management. Anterior epistaxis, commonly known as a nosebleed, originates from the front part of the nasal septum. This is a frequent occurrence and can be quite alarming, but understanding its causes can help in managing and preventing it. This area, known as Kieselbach's plexus, is rich in blood vessels. The high concentration of these vessels makes it a common site for bleeding. Several factors can lead to anterior nosebleeds. Common culprits include trauma, which can range from a direct blow to the nose to more subtle forms of injury. Even minor trauma like nose picking or blowing too hard can cause bleeding. These actions can damage the delicate blood vessels in the nasal septum, leading to a nosebleed. Dry air can irritate and dry out the nasal lining, making it prone to bleeding. This is especially common in winter months or in dry climates where the air lacks sufficient humidity. Allergies, particularly allergic rhinitis, can cause inflammation and congestion in the nasal passages, increasing the risk of nosebleeds. The constant irritation and swelling can weaken the blood vessels, making them more susceptible to rupture. Upper respiratory infections like the common cold can inflame the nasal lining and lead to bleeding. The infection causes the blood vessels to become engorged and more fragile, which can result in a nosebleed. Though less common, benign or malignant tumors in the nasal cavity can also cause anterior epistaxis. These growths can disrupt the normal anatomy and function of the nasal passages, leading to bleeding. Additionally, the use of certain medications, such as nasal sprays or blood thinners, can increase the likelihood of nosebleeds. Nasal sprays, if overused, can dry out and irritate the nasal lining, while blood thinners can make it easier for bleeding to occur. High blood pressure is another factor that can contribute to nosebleeds. Elevated blood pressure can put extra strain on the blood vessels in the nose, making them more likely to burst. Stress and anxiety can also play a role. When a person is stressed, their blood pressure can rise, and they may engage in behaviors like nose picking or rubbing their nose more frequently, which can lead to nosebleeds. Staying hydrated and maintaining a healthy environment with adequate humidity can help prevent nosebleeds. Using a humidifier, especially during dry seasons, and drinking plenty of water can keep the nasal passages moist and less prone to bleeding. Understanding these causes and considerations can help in managing and preventing anterior epistaxis. By taking simple precautions and being aware of the factors that contribute to nosebleeds, you can reduce their frequency and severity. Posterior epistaxis arises from the back part of the nasal cavity, involving larger blood vessels. Unlike anterior nosebleeds, which are more common and usually less severe, posterior nosebleeds can be quite alarming. The bleeding originates from arteries located deeper in the nasal cavity, making it more challenging to manage and control. This type of nosebleed often requires medical intervention to stop the bleeding effectively. This type of nosebleed tends to be more severe and difficult to control. Patients experiencing posterior epistaxis may notice blood flowing down the back of their throat, which can lead to coughing or vomiting blood. Immediate medical attention is crucial to prevent significant blood loss and other complications. Posterior nosebleeds are often associated with underlying medical conditions such as hypertension. High blood pressure can weaken the blood vessels over time, making them more susceptible to rupture. Regular monitoring and management of blood pressure are essential for individuals prone to nosebleeds. High blood pressure can put stress on blood vessels, making them more likely to rupture. This stress is particularly concerning in the delicate vessels of the nasal cavity. Managing stress and maintaining a healthy lifestyle can help reduce the risk of nosebleeds. Atherosclerosis, hardening of the arteries, can affect blood flow to the nasal cavity, increasing the risk of bleeding. This condition is often linked to lifestyle factors such as diet, exercise, and smoking. Addressing these factors can help improve overall vascular health and reduce the likelihood of nosebleeds. Nasal tumors. Tumors in the posterior nasal cavity can cause bleeding, especially as they grow larger. These tumors can erode blood vessels, leading to significant bleeding. Early detection and treatment of nasal tumors are vital to prevent complications. Trauma, severe facial trauma can lead to posterior epistaxis. Injuries from accidents, falls, or physical altercations can damage the blood vessels in the nasal cavity, resulting in heavy bleeding. Protective measures and prompt medical care are essential in such cases. Inherited bleeding disorders, conditions like hemophilia and von Willebrand disease can increase the risk of both anterior and posterior nosebleeds. These genetic conditions affect the blood's ability to clot properly, making even minor injuries a potential cause for concern. Regular medical checkups and appropriate treatments can help manage these disorders effectively. Diagnosing the cause of epistaxis begins with a thorough medical history and physical examination. Doctors will ask about the frequency, duration, and severity of nosebleeds. They'll also inquire about any underlying medical conditions, medications, and recent trauma. A physical exam involves visualizing the nasal cavity using a nasal speculum. This allows doctors to identify the bleeding site, look for any structural abnormalities, and rule out other potential causes. In cases of recurrent or severe epistaxis, nasal endoscopy may be necessary. This procedure involves inserting a thin, flexible tube with a camera into the nasal cavity, providing a detailed view of the nasal passages. First-line treatment, stopping the flow. The initial management of epistaxis focuses on controlling the bleeding. Simple measures often suffice for anterior nosebleeds. Applying direct pressure to the soft part of the nose for 10 to 15 minutes is usually effective in stopping anterior nosebleeds. Sitting upright and leaning forward helps reduce blood pressure in the nasal veins and minimizes swallowing blood. Over-the-counter nasal decongestants like oxymetazoline can constrict blood vessels and help control bleeding. Advanced management when bleeding persists. When nosebleeds become persistent or severe, especially in cases of posterior epistaxis, it often requires more advanced and invasive management techniques. These techniques are crucial in ensuring that the bleeding is controlled effectively and that the patient is stabilized. For persistent or heavy bleeding, especially in cases of posterior epistaxis, more invasive procedures may be required. The first step often involves a thorough nasal examination to identify the source of the bleeding. This can help in determining the most appropriate treatment method. Nasal packing involves inserting gauze or a specialized nasal sponge into the nasal cavity to apply pressure and promote clotting. This method is often used when simpler measures, such as pinching the nose, have failed to stop the bleeding. The packing material helps to compress the blood vessels and reduce blood flow. If the bleeding source is identifiable, cauterization can be used to seal the blood vessel. This procedure involves applying a chemical or heat to the bleeding site to close off the vessel and stop the bleeding. It is a highly effective method for controlling localized bleeding. This can be done chemically with silver nitrate or with heat using electrocautery. Silver nitrate is a chemical compound that causes a chemical burn, effectively sealing the blood vessel. Electrocautery, on the other hand, uses an electric current to generate heat and cauterize the vessel. In cases of severe posterior epistaxis, embolization may be necessary. This is a more advanced procedure typically performed by an interventional radiologist. It involves navigating through the blood vessels using imaging guidance to reach the bleeding site. This procedure involves injecting a substance into the blood vessel to block blood flow and stop the bleeding. The substance used can vary, but it is designed to create a blockage that prevents further bleeding. This method is particularly useful for controlling severe and hard-to-reach bleeds. Surgical intervention is usually reserved for cases where other treatment options have failed, or if there is a structural abnormality contributing to the nosebleeds. This can involve correcting any anatomical issues or directly addressing the source of the bleeding through surgery. It is often considered a last resort, but can be life-saving in critical situations. Epistaxis and the future research and innovation. The field of epistaxis management continues to evolve. Researchers are exploring new technologies and treatment modalities to improve patient outcomes, such as bioabsorbable nasal packing. These newer packing materials dissolve on their own, eliminating the need for painful removal. Topical hemostatic agents promote clotting and can be applied directly to the bleeding site. Minimally invasive endoscopic techniques allow for more precise and effective treatment of posterior epistaxis. Conclusion: confidence in confronting epistaxis. Epistaxis is a common medical condition that presents unique challenges. By understanding the anatomy of the nasal cavity, the causes of anterior and posterior nosebleeds, and the available treatment options, medical students and practitioners can confidently manage this condition. Staying informed about the latest medical guidelines and best practices is crucial. Through ongoing research and innovation, the field of epistaxis management continues to advance, offering patients safer and more effective treatment options.